Diabetes is a chronic disease that cannot be cured but can be treated. The proposed strategy in the treatment of diabetes has several components that will be discussed in this training. The treatment aims to achieve the following objectives: to eliminate the symptoms of diabetes, to prevent diabetic ketoacidosis or hypoglycemia. These are two acute complications that could occur suddenly and need attention immediately. To prevent or delay the onset of long-term complications affecting all organs, including the heart, kidneys, eyes, and nerves. And finally, the ultimate goal is to improve the quality of life of individuals living with diabetes. The active involvement of individuals with diabetes in their treatment is essential to achieving these goals. The role of a healthcare professional is to support these individuals and equip them with the tools they could use to manage diabetes in all aspects of their lives. The following components are at the core of an effective diabetes management strategy: regular physical activity, eating in a healthy and balanced way. These two previous components contribute to weight control or weight loss if needed. Finding ways to manage your stress, measuring your blood sugar at the appropriate times, and taking anti-hyperglycemic medication or injecting insulin as prescribed. A healthcare professional can help guide you in setting priorities and determining ways to ensure the actions you take achieve the maximum health benefits. He or she, of course, will also take into account your personal traits and concerns. The target blood glucose values should be individualized based off of age, duration of diabetes, the risk of hypoglycemia, the presence of cardiovascular disease, and life expectancy. Here are the target blood glucose values for most people with diabetes. Fasting and before meals, 4 to 7 millimole per liter, and 2 hours after meals, 5 to 10 millimole per liter. In older adults with a high level of fragility, the fasting and before meal blood glucose target is 5 to 12 millimole per liter. The following are the targets for glycated hemoglobin, or A1C. Less than or equal to 7% for most people with diabetes. Less than or equal to 6.5% for people with type 2 diabetes to reduce the risk of developing kidney disease or retinopathy while taking into account the risk of hypoglycemia. And 7.1 to 8.5% in people with limited life expectancy, significant functional dependence, coronary heart disease with a high risk of an ischemic event, multiple comorbidities, recurrent or unperceived severe hypoglycemia, and for people with long-term diabetes with no possibility of attaining an A1C less than or equal to 7% despite optimized insulin medication. This course has been made possible with the financial support of Rush Diabetes Care, a division of Hoffmann La Roche Limited.